In this presentation, I'm going to go over our primary survey steps. So the objectives obviously are to learn the steps for a primary survey. A primary survey's purpose is to really determine the function of our cardiovascular, which is our heart and our lungs, our breathing, and our CNS, which stands for central nervous system, or our brain. Those are the two critical areas in our life that we got to make sure that a person is breathing and they haven't sustained some kind of head or neck injury. We also want to determine quickly the seriousness of the injury and what care to provide for that particular athlete when they're hurt. So the steps from our textbook are assess the scene, assess the athlete, alert, and attend to breathing. Now I'm going to go over each one of these steps using another steps that I've learned, and I think it comes from like the American Red Cross and some of the CPR classes that you'll end up taking for our class when you take your CPR course. So we have the primary survey steps again. We survey the scene. This is in the assess the scene in our textbook. Determine the level of consciousness. Again, that's in the assess the athlete step in our book. Activate EMS or call 911. This actually falls into two different steps from our book. Assess the athlete and alert. ABCs, attend to breathing in our book. Check for severe bleeding. It's kind of part of attend to breathing in the textbook, not necessarily. And move to secondary survey once we're done with primary survey steps. So now I'm going to go over each one of these steps in detail. And again, if you've done a CPR class, this should be a review for you. First thing we do is I'm going to set up a scenario where you're working a game and somebody gets hurt. They're down. The first thing you do is survey the scene, or if you're in a public setting and somebody gets hurt and you come across them and you make the decision that you're going to provide care. First thing you need to do is quickly determine the following. As you check the scene for safety, you look around, like in the picture of the guys looking around, making sure the scene is safe for you and for the person who is injured. Make sure it's safe. You want to put on your latex gloves or gloves. They don't have to be latex, but you need gloves. You need to protect yourself from blood or any other bodily fluids. So you should have those if you're the person who is the designated first aid responder person. Put on your gloves. Sometimes you have to wear masks and stuff like that. You also want to protect the athlete from further harm, or the patient if you're in a non-athletic setting, like if there's cars or stuff like that. There might be bystanders around, so in athletics, this would be other athletes or the coaches or the officials. Tell them, excuse me, can you move back, please, so I can provide the care. So you're checking the scene, you're looking around, make sure it's safe. You're trying to determine what's going on with them. If that person is conscious, that's a good sign. We already know they're breathing and they have a pulse. Keep them calm. We'll talk about later in our class about shock and how to take care of shock. A lot of people, when they get injured, have severe injuries, they can go into shock. One way we can keep them from going into shock is by keeping them calm. It's okay. You're going to be okay. Okay. Just you need to be calm around them too. You may freak out on the inside, but you should be calm on the outside. The other thing is then we evaluate the athlete or the patient. We notice the body position. What position is their body? Do you notice a leg in a weird shape or an arm in a weird shape? Is there blood? Is there equipment that they're wearing? Is it not on correctly because of the hit that they took? Whatever it may be. So we want to notice all these things really quick. What we're trying to do here when we're doing these things is determine how the injury happened. We call this MOI, or mechanism of injury. Now this step should take seconds. Walk up, look around, look down at the athlete. Excuse me, pardon me. You look down, make a quick scan from the head to toes and trying to determine what's going on with the person. Now, this doesn't take that long to do. You want to move all this primary survey needs to be done quickly. Again, it's primary because the two main things we're looking at is stuff that can cause the person to die, be paralyzed, and those type of things. So next step is determining the level of consciousness. If the person's talking, you know they're conscious, so you can skip it once you know that person's awake. But if you're not sure, you tap on the shoulder, you ask loudly, "Are you okay? Are you okay?" If there's no response, you assumed they are unconscious. You assume they have a head or neck injury. We always assume that they have a head or neck injury until we can rule that out. We can determine that there is no head or neck involvement in the injury. So again, tap on shoulder, "Are you okay? Are you okay?" No response, they're unconscious. If they're conscious, then we go down a different path. Okay. Next part of this, as soon as you determine that you have an unconscious person, you need to activate the emergency medical system, also known as 911, right away. As soon as that you determine that you don't have a conscious person, you immediately call 911. What I've noticed is a lot of students, when I test them on CPR and the steps and all that, this is the step that they forget to do, is right after they say, "Are you okay?" or "Okay," they forget to call 911. This is the step that you need to do right after you determine unconsciousness. When you call 911, you need to provide the following: your name, exactly where you're located. You need to be very specific. If it's an odd place, you're not right on a street, you're out on a field, on a soccer field or inside a gymnasium, you need to give them complete specific directions how to get to where you're at. A lot of times I recommend that while you're making a phone call, if there's somebody around, you designate somebody to go meet the ambulance or the paramedics to show up so they can direct them to you. Exact location. The type of emergency you're having, all you can tell them at this point is, "I have an unconscious soccer athlete who was hurt during a game." If that's all you know, that's all you know at this point. The number of victims, you may have more than one. And what kind of care is being provided at this point. At this point, nothing's being done. We just assess the scene. We just determine what's going on. You can also designate somebody else to call 911 while you're providing the care. Okay, so that's another thing. In the class, you're going to develop a emergency action plan, and you're going to be asked to provide this information for your setting, especially the exact location. So you're going to try to provide all the locations for your athletic team that you are coaching or providing care for. And the last thing is the phone number. Now, one thing I'll say, when you call 911, if most people use cell phones nowadays, a couple things to keep in mind when you call 911 on your cell. It's going to not direct you to a local police department like if you call on a landline. So it's going to get routed to somewhere else, then they'll take that information and send it to the local fire department and police department. The other thing that's happened to me when I've called 911 is I've been placed on hold. It's really quick. Because they might have a lot of calls coming in at that time. And they say, "Can you hold for a second?" And you say yes, and they usually come right back, just so you don't freak out because you're in high panic mode at this point. Okay, after you call 911, we're going to check our ABCs. Airway is the A. Is the airway open? So how we do this is we tilt the head, lift the chin. Again, when you take your CPR class, you're going to be going over all this. Look, listen, and feel. So you see in a picture there that the person's got their ear down by their mouth and they're looking at their chest. We're going to give them 2 rescue breaths, and see if the chest rises when you give them their 2 breaths. And for a conscious person, again, coughing is good. We're not going to do all these things for a conscious person. This is for the person who's really unconscious. So that's the airway. Tilt head, lift chin, look, listen, and feel for about 10 seconds. Whoops, I Just notice that I have a spelling error. It's supposed to be seconds, not sections. 10 seconds, 2 rescue breaths. Okay, you want to go breathe, breathe. You're going to plug the nose, seal your mouth around their mouth, breathe, let go of the nose, let the air come out, pinch the nose, take a deep breath and breathe into them. You don't want to take a super big breath. You just want to take a normal amount of air in your chest. And you're looking for the chest to see if it's rising when you give them the breath. Because if the chest is not rising, that means it's blocked by something. Again, you'll go over that in the CPR class. So breathing, again, we're listening, feeling for their breathing. Is it normal? Is it fast? Is it slower? Or is it no breathing at all? So that's the B, airway breathing. And circulation, we don't really check pulses anymore in CPR. What they have found that we just go straight to CPR if somebody's doesn't show signs of life, and that's what the next thing, signs of life, or the breathing, and those type of things. So again, I'm not going to go over the CPR stuff in this course because you are going to take a CPR class, and this is a refresher for those who have taken it and when you take your CPR class. The other one is check for severe bleeding. We're going to do this during that circulation exam. You're going to look for blood. You're going to start from the top of the body, the head, and scan all the way down to the toes. You're looking for a lot of bleeding, not just a little scrape or something like that, but severe bleeding. That's what we're looking for. And if there is severe bleeding, you may not be able to control it, but somebody else around you may be able to control the bleeding, especially if it's spurting out and stuff like that. We got to stop that bleeding because that's somebody can die. Again, our primary area is cardiovascular and central nervous system. So you've called 911. The ambulance is on the way. The person doesn't have severe bleeding. But they have a pulse, or excuse me, they have signs of life. That means they're breathing, but they're just unconscious. What we do there is if we don't think they have a head or neck injury, we put them in a recovery position, which that picture is showing for the recovery position. We want to stabilize the head. Don't move if you don't need to. And do not remove the helmet. This is more the football and some other helmet sports. And you may need to remove the face mask. Again, this is now, if they need, the other thing I should have provided, what I should have put in here is provide the care that is needed. That's one thing I forgot to include on my bullet points there is if they need CPR, you do CPR. So you provide the care that is needed at the time. So you're going to be doing CPR and AED on that type of stuff while you're waiting for the paramedics to show up. Again, primary survey is done to quickly, and again, it's quick. This shouldn't take longer than 30 seconds to do this step. Quickly to determine the severity and a type of injury. Do we want to make sure that they are conscious? Are they breathing? Because if they're breathing, they have a pulse. If they're not breathing, we assume that they don't have a pulse, and we need to go straight to CPR. And to identify what kind of care is needed immediately. Again, this is all high emergency management stuff here that we'll continue to talk about in our course. We'll talk about what to do with an unconscious athlete in a later class. And that's it.